If your child has a bad cough and a runny nose, it may not just be a common cold.
Yeah, we're in the peak season for RSV, which is a respiratory virus affecting thousands of children in our area. Meg Gatto reports.
The symptoms can last weeks and often mirror a common cold. But for children, RSV can be dangerous.
In the pediatric population, it can definitely be more serious, where kids can have lots of runny nose that can then trickle down to the lower respiratory tract and cause difficulty breathing.
RSV stands for Respiratory Syncytial Virus. It's very contagious.
It's by droplet secretion. So somebody sneezes or breathes on you, and then you touch yourself, and then that's how you can get it. So the same way that it's contagious is the same way that it's transmitted.
RSV has been around for years, but if you think you're hearing about it more now, that's because we're in the peak season.
So what you're seeing is the most cases of RSV at the moment, and then when it coincides with flu season, sometimes the kids can get really sick because if they have RSV and flu and it's back-to-back viruses, it can lead to some trouble.
Dr. Reena Mehta suggests if your child has symptoms like a heavy cough, fever, and runny nose, and it's lasting longer than 3 to 5 days, it's time to have them checked out. But beware, there's no magic cure.
A lot of it is just supportive care. There's no antibiotic or medication that you can take to make this go away. It's usually deep suctioning of the nasal secretions that really does help kind of move things along. And if a child is having some wheezing and things like that, then certain nebulized treatments can sometimes help.
The RSV season doesn't end until January or February, so unfortunately doctors are prepared to see many more cases in the coming months. Meg Gatto, Fox 8, Local First.
Last year, there were a reported 2 million outpatient visits related to RSV, with 50,000 children hospitalized.